and hopefully those queries and questions raised have been dealt with. So now looking for the support to take this off to Welsh Government in partnership with Torfaen Council.
Thank you, Nicola. Comments and questions, please. Paul?
I think that this is an exciting development and plan. And one of the reasons I'm fully supportive of it is on the basis of the well-being of the Future Generations Act, because we have got a responsibility to ensure that whatever we do, we are protecting the future. And I think this is one example where there's been extensive engagement across partner agencies, including Welsh Government and I think universities and local government and local authorities. And from that point of view, I think we should move to the next stage. I just want reassurance on the financial part of it, because I think that's one of the issues that's come up really.
Nicola?
Yeah, so in terms of the costs, we are not anticipating that this is a capital cost that we would be expected to fund. It is about working with industry and the benefits industry can get in working with us, and therefore would be looking to invest in that site. So that's kind of how the Medipark. Obviously, the plans we would have for our own development on that site would be our own responsibility to take forward through this standard business case process. So at this point, we're not anticipating any financial commitments for the Health Board. I think the debate is around the land, you know, how we would manage any land disposal or lease, but that would all be picked up throughout the further process.
Okay.
But that should be seen as a cost rather than an opportunity rather than a cost.
Okay.
Thank you.
David?
Thank you, Anne. Yes, as you say, we did have extensive discussions on this many weeks ago now. My concerns are really still the ones that I had back in those meetings, and on the first issue really of COVID, the points that I've made before were that pretty much every large-scale capital building related project is being reconsidered in the light of COVID. And it might be that because of COVID and a post-COVID world, the demand for this facility actually is even greater than it would be before. That's quite possible. And the very best use of this percentage of land that we have on the site could be absolutely best used because of the way that COVID's changed the world. Or the opposite could be true. It might actually be that the requirement for land is going to be greater in a post-COVID world, and therefore it may be a mistake to go ahead with this development. Now, I absolutely understand we're not committing any money here, and we're not suggesting going ahead with the project. But my question about COVID, I guess, really is, because all of COVID emerged after the SOC was written, then ought we to reconsider the project in the light of COVID? And that reconsideration might just be a case of saying, well, we just don't know when the next 6, 9, 12 months are going to be. So the very best option at this stage is simply to put it all on hold and review the. That's my COVID question. My other question is this issue about commercial viability. And obviously the paper says that the purpose of the SOC was to test the commercial viability. And I'm still struggling really to see where the commercial viability is, on the basis that fundamentally the requirement here is to find commercial paying tenants who are going to be moving businesses and building businesses at this location. So were we to move to the next stage in the process, because we did feel that everything at this stage was something that we wanted to go ahead with. Again, my suggestion wouldn't necessarily be to move to an OBC. It would be to specifically look at that exact issue of commercial viability. And if that particular thing is passed, then I could see there's a good reason to essentially progress the project in the way that the paper's suggesting. So it's those 2 points then, really.
Thank you. Nicola, would you like to address those?
Yeah, thanks, David. So I know we have had this conversation previously as well, and I think they're important points. I think the COVID issue is a point well made, but I think would absolutely be picked up as part of the next stage. You know, the Torfaen Council has approved this on the 7th of July, which is important, will be in the context of what we were facing around COVID. And I think, you know, we can naturally factor that in as we move forward into the next stages. So that would be a consideration we would expect to be part of that next assessment. And I think your point around the commercial viability, so over at a very high level at a SOC is considered to see, is there a commercial case for this? And there, I know previously we've shared some of the kind of very informal discussions that have been had with industry around their interest in a project like this. I know the team have been working closely with the Cardiff City Deal team, and you know there is sufficient feedback and evidence to support that there would be commercial interest in this project, and sufficient interest, I think, in order to, you know, at a SOC level to consider there's a commercial interest in it to proceed to the next stage where that could be tested, as you said, in a much more diligent way than what we would have done at this stage. So I think your points are well made, but I think there's been sufficient interest in the work that some of the team have done with industry to support that at this stage.
Okay. Sarah, did you want to pick up the COVID point?
Yes, please, Chair. I think if we look at the evidence of the influence of the COVID pandemic on healthcare system design to date, all of that evidence would suggest that the pace of innovation has increased dramatically. In previous board meetings, David, you know, we've discussed the fact that in the private sector, you know, adoption of technology and innovation is more nimble than in the public sector, and the NHS has demonstrated the ability to be nimble and adopt technology and innovation at speed over recent months. There is no appetite to go backwards on that. I think the entire direction in terms of clinical pathways is to build on what has already happened and continue in that direction. We have, Welsh Government will be introducing the new clinical framework, which will introduce national pathways based on latest evidence, and therefore will continue that direction of travel around what the evidence says is the best approach. And I can't see any evidence that the COVID pandemic would actually take us backwards on this. I think the evidence is all pointing in acceleration rather than going backwards.
Thank you. Richard?
Right, I'm unmuted. I think in my declaration I said Torfaen had made no decision. I was referring to the decision as a whole, not the decision on this specific one that was taken to Cabinet. I think this is an important decision, not only for the Health Board, not only for Torfaen, not only for the Health Board footprint, but the wider area, the capital city region, which supports this. It's in line with the rebuilding of the economy in this area and channeling new skills and exploiting existing skills within the area. As Paul rightly said, it meets the ticket of the future generations, that we are preparing ourselves for the future. We as a health board are innovative, slow in that innovation, but we are innovative. And I think this will take us to the cutting edge of that, where we can't do the same old that we've done for years. The possibilities and exploitation of the Medipark and the hub, etc., can change the whole dynamic of how the health board operates in the future. I think COVID actually assists this operation, whilst government policy is quite clear that rather than the chaos that we saw at the beginning of COVID with trying to get things from England, Wales, Scotland, we are Wales, so I don't know why I said Wales, other parts of Wales and Europe and further abroad, that to bring it closer to home and to source that with the innovation and the production closer to home. David's points are totally well made. He's made them on a number of occasions. and I fully understand where he's coming from. And if this were the outline business case before us to say, let's press the button to go further, and those questions were still being raised by David and others, I would probably support that myself. Nicola and Sarah have given us assurances that COVID issues can be looked at in the outline business case, and indeed the economic viability of this. We have some benchmarking, dare I call it, from SQW. These are informal conversations. These aren't people saying, yes, we'll come if you build it, we come, but rest assured, if we don't build it, they definitely won't come. So on the basis of it's a way going forward to test those matters, I fully support the report before us, whilst acknowledging David's, dare I say, reservations. Sorry not to put words into your mouth, but as I've said, if those reservations are still there at the end of this process, I probably would be considering the position very well. The other point I would like to make, we've had two excellent reports today on the early opening of the University Grange Hospital. I was back there years ago, not involved with the health board, but locally when it was proposed that it would be there on the Craigavellin site, and I was beginning to wonder if we'd ever see a single brick laid. And similarly with the cancer therapies report that we've just considered, that has been going around a long time. I'm sorry, David, to delay this 6, 9, 12 months, I just think would be crazy at this particular time. Though I respect your point and would probably even support it, as I've said 3 occasions now, if that was the result of the outline business case. Thank you.
Thank you, Richard. Pippa?
I suspect that I'm probably reflecting quite a lot of what people have already said. I think for me, there were 2 points that I had some concerns around. The first one is whether or not COVID will impact the businesses that might move onto the site. So whether any of those businesses, we know that some businesses are failing and some are growing. And I would be very keen to see a focus in any outline business case on whether or not the outside commercial ventures were in that situation. And I think that's something that without that information, I don't think a decision could be made in the future. And the other focus that I'd like to see in any case moving forward is around whether or not this is the best use, the absolute best use for this particular parcel of land, because there may be other sites for the Medipark. Moving forward, we need to think about the health of our population and how do we serve the health of our population in the very best way. And I think that land space sometimes is an opportunity for us to move different services together into the same space. And if we lose the land, we've lost the land forever. So I would be very, very keen to have a focus on those 2 areas. One would be, is there any other potential use for the land we could anticipate in the future? And the second one is whether or not commercial ventures who would move in are likely to be growing or shrinking given the COVID background. Thank you.
Thank you, Pippa. Do you have your hand up, David? No. Okay. Richard?
Oh, sorry.
Oh,
I didn't put it down.
Sorry.
No, my fault.
Are there any further questions or comments? No? Right. Well, some very valid comments have been made, particularly in terms of the commercial case, which would remain to be tested in any OBC anyway, and whether or not it's been affected by COVID. And I think it's a legitimate question, particularly in the circumstances, and it would be tested in an OBC. And also, is this the best use of the land, which again, we would be testing as we go through the discussion on what the land in the whole, including the Welsh Government land, which is adjacent to it, will be used when we go through the business cases for the future use of the site. What we're asked to do is, does the board agree the concept of, in itself, of a Medipath and the assumptions of wider benefit for the health board, and does the land, the potential use of health board land for the proposed 2-phase, in recognition that this would still leave development, is that feasible and desirable for us? It's a key question, as you see in your papers. And does the board support as a representation of a future director of travel for Llanbechwer Ground, with or without the Medipark? And are we prepared to endorse a strategic case to explore further through an OBC the absolute requirements of the commercial viability, the use of the land being optimal for health benefits within our area, and the other cases, and certainly the point that Pippa has made in terms of, are they growing, these businesses, or are they not? And really, how feasible are we going to, how feasible is this proposal going to be when further work, particularly into the commercial case, is made? This again does not commit us, as it says here, do not commit the health board by way of land disposal or anything to do with money. And I put it to you, are you happy to endorse the recommendations or not?
Yes.
Yeah, yes.
Yes, some people are looking, yeah. Okay, fine, thank you. That's agreed for the moment, and we will keep a very strong look oversight of this at the Strategic Planning and Change Group. Thank you. Newport East Health and Wellbeing Centre. We have again discussed this in the past, but this is the OBC, which we agreed would be presented to you. Nick?
Yeah, thank you, Chair. And so I don't propose to go through the whole OBC because, as you said, we gave a briefing at the Planning and Strategic Change Committee in July. So the board is asked to support the outline business case for the construction of a new health and wellbeing centre in Newport East on the site currently occupied by the Ringland Health Centre, with an estimated capital cost of around about £26.25 million. This development is part of the Primary Care Pipeline programme, and we have outlined support from Welsh Government as part of that for that development. And it is also worth noting that this is part of our overall estate strategy for the development of integrated service hubs in locations which provide service therefore closer to people's homes and in areas where we've got poor health outcomes and higher levels of deprivation. So the case it is made. It is a significant capital investment of, as I say, £26.25 million. The next paper on the agenda is for the full business case for Tredegar Health and Wellbeing Centre, and both of these have a similar cost per square metre. The size of the Newport Health and Wellbeing Centre is the main driver of the overall cost. The proposal for the development has been discussed for a number of years in conjunction with Newport City Council, Newport City Homes, and is part now of an integrated service development and construction facility in the centre of the Ringland estate, which will provide both an upgraded council neighbourhood hub and our health and wellbeing centre. They will be joined physically by a sort of shared entrance, and within the OBC you can see some of the plans of the site, and we are in the process of working with Newport City Council and Newport City Homes to develop the most appropriate service model and therefore benefits to the general public in terms of the services that they will be able to access. There is a slight revenue increase on the back of this development, which is driven mainly by the additional expenditure that we are anticipating in providing expanded GDS services, so that's general dental services. As a health board and the primary care and community division over the past 2 years, we've been actively pursuing additional GDS activity to improve access and improve people's access to dental health. And in particular in this area, we do struggle with provision of dental care, and the opportunity afforded here of an additional 4 chairs within the centre will provide for considerable additional general dental activity on the site. So it's not a direct consequence of the building itself, it is more of a service development that we are seeking to deliver through this building. And over the period of the construction period, we'd work with the contractors and Welsh Government to ensure that we had the revenue to support that. There's a further revenue expenditure increase in some of the other services, a smaller amount in primary care services, estate and ICT. Services in the area currently of the 2 GP practices are at Park and at Ringland, have long been unable to provide the sort of integrated service provision that we are seeking through the sort of primary care plan that we've got locally in Gwent. And the development of this centre and service will allow us to provide a much wider provision of service and link that to the local authority and third sector services that are currently provided in the area. We currently deliver a number of services such as sexual health, speech and language therapy, midwifery, etc. And we will increase the provision of these services through the development of this health and wellbeing centre. I think the other point I would make is really around the sustainability of GP and GMS services in the area, and it's long been a challenge for us in terms of the delivery of services in Newport East. And whilst that's been much more stable over the past 12-18 months, as we've developed this business case, there is a case to support bringing these 2 practices together in a new building, which will allow a wider development of the multidisciplinary approach in both practices, which obviously adds to the sustainability and our ability to provide better access to services in Newport East. And certainly this building will provide us with that opportunity. The current context in terms of the estate that we have is that both Park and Ringland are very poor practices. The current Ringland Health Centre will be demolished and the new service will be built on that site. And we've got agreement from both Park and the current Ringland service to move into the premises on a shared basis rather than as a merged practice at this point in time. Notwithstanding that may change over the next 3 or 4 years as the building and the process develops. I wasn't going to go into any further detail around the commercial and financial case that's outlined in the OBC because we've discussed this on many occasions. And I think obviously this is quite an exciting development. It will probably be the biggest health and wellbeing centre that we've got in the Gwent area and provide us with a huge opportunity to bring services together and provide care closer to home to a quite a vulnerable population in an area of quite significant deprivation and health inequality. And we will therefore be able to start to work towards bringing that together. The other thing worth mentioning is that it will replace a number of services and buildings that we've got in the Newport area into this thoroughly modern and 21st century health and wellbeing centre. So happy to take questions, Chair.
Thank you, Nick. I have Tej, Shelley and Paul. Tej?
Chair. Thank you, Chair. I'd just like to endorse this business case. I think an enormous amount of work has been done. I sit on the Newport Public Service Board, and I know how much collaborative work has gone into engaging with active contribution from partners, the City Council and social landlords, the third sector and the community. And I think, you know, we have worked in the third sector, certainly have worked for many years and hoped for this kind of integrated model. And I just think it's fantastic to see that we're at this place now. If I can just a point of detail. In 3.9 of the report, we say that option 3 is preferred because it's the only option that meets the investment objectives, which are stated in 2.8, and those are just listed there. And I think it would be useful to have on note how those investment objectives were come to.
Nick?
So I think my understanding is the investment objectives are part of the pipeline, the primary care pipeline programme from Welsh Government around integration, bringing services closer to people's homes. So I'd have to double check that that's the source of them. I think is from there. I mean, certainly within the next business case, they are the same objectives for Tredegar, and they're the same objectives that we're seeking to meet as part of the development of any other business cases for health and wellbeing centres, and they're clearly part of our overriding estates strategy for primary care.
Okay, thank you.
Shelley?
Thanks very much. I agree with Teacher. I think this is a very good report and obviously fully support it. 2 points of, again, detail. In relation to the actual clinics that are involved in this particular the new location, etc., you mentioned Nick, Ringland and Park, I think, obviously on board, albeit co-locating. I wondered what the situation was with Olway Clinic and Clive Clinic. So are they currently engaging? I appreciate time will move on, but would we progress with this regardless of whether those clinics were prepared to come on board at the end of the day? And the other point, and I'm going to raise this point as well for Tredegar, Nick, is on page 3 of the report. You talk about a draft benefits realisation plan is being supported, and I just wondered what the detail of that was, and is that something that we would need to see or should be seeing as part of this submission? That was my quick, because I just wondered why it wasn't here.
Nick?
So in terms of the two general surgeries, GMS provision are moving into the building, and we've agreed that with them. There is no plans at the minute to merge them, but there is no, and the building has been designed to have 2 GP services within the location. Olway Clinic will be closed and will become part of the service that are provided out of Ringland. And the current plan is the vast majority of Clyther will move into Ringland, with potentially the remainder of Clyther moving to another location within Newport. So therefore we can close what is a out of date and building that's not really fit for purpose as we move forward. In terms of benefits realisation, I think it's recognised that within a lot of these health and wellbeing centre developments, there is a need to really develop a benefits realisation programme and plan, and that Welsh Government have recognised that in a number of developments and are working with us to bring that to a sort of conclusion as we move these OBCs and FBCs forward. And I think it was something that we probably do need to share with the board as we progress these developments, maybe in a discussion around the estate strategy or some of the other estates meetings and developments that we've got.
I think it's really important that we have clarity on the benefits that will accrue to the community as a consequence of our building programmes. I think that's important. Paul and then Emrys.
I mean, I think that I was going to raise about the benefits realisation. I think we should have some sort of pro forma or template whereby key questions are looked at and then addressed. But I think in terms of concepts, this is a superb concept in terms of having a health and wellbeing centre. And I think in terms of, again, what I mentioned previously, the Wellbeing of Future Generations Act, you know, what we're doing is to invest in a community and improve the health and well-being. And also, I think there's a focus on sort of the public health and prevention agenda as well. So I think that what we've got here is a great idea, great concept. And I think let's move on with this, as I will be supporting Newport as well as Tredegar. I think these are great for local communities.
Thank you, Paul. Emrys?
It's just to echo the last two colleagues' points, Chair, is that but it's about the benefits of integration, which is one of the key points we've got to take out from this, is because it's not just a location of services, it's about what are the benefits of having integrated working and the outcomes that we can achieve from that.
Thank you, Emrys, for that clarification. So are there any further questions? Tees, you've got your hand up. Okay.
And should I just pick up Phil's point in the sidebar about social care?
Yes, please.
So, social care will be currently planned to be located in the Newport neighbourhood hub, which is obviously next door to our health and wellbeing centre and jointly accessible. I think it'd be fair to say, Phil, that discussions will be ongoing over the next 2 or 3 years about how close that proximity becomes as we move to a more integrated service model.
Yeah. Thank you, Nick. If there are no further questions or comments, are you prepared to support this OBC? Thank you. Thank you very much. And we move to Tredegar.
Yes, thank you, Chair. So this is the full business case to support the construction of a health and wellbeing centre in Tredegar. On the site of the old Tredegar Hospital, which, as we all know, is the birthplace of the NHS. It has a capital cost of 17.195 million, and the outline business case was approved by the board in late 2019 and Welsh Government in January 2020, which also included a provision to support the demolition and groundworks for the development of this health and wellbeing centre. Those demolition works have commenced, and it is anticipated that the groundworks and that what's called the grouting of the existing site will be complete by April, and therefore the approval of the FBC will allow us to move to full construction from May of this year, with a likely opening date of December 2022. This development has been on the part of the estate strategy since 2005 and was subsequently included in the Welsh Government's primary care pipeline for completion by the end of 2021. And it was felt that it was the preferred way forward in terms of provision of services within the Tredegar area, where we have struggled to provide both GMS, GDS and community dental services over the years. Through a new health and wellbeing centre was the best way forward, and it is a really important development to the local population and the local area, as it will give us the opportunity to provide for the first time that integrated primary care model on a single site, obviously on an existing health footprint in terms of the old Tredegar Hospital. It absolutely supports the sustainability of services within Tredegar, where we have currently two practices, one of which is a managed practice, which is on the current site of the Tredegar Health Centre, which is next to the hospital, which has been a real challenge for us over the last few years in terms of maintaining provision and access to the population. So I think the development of this site in particular, the community and health and well-being element of the development in terms of its retention of all of the history and culture that surrounds Tredegar Hospital, and will allow the development of a community support network and meeting place, I think is really, really important. Interestingly, we've had very little challenge in bringing the two GMS providers together. Obviously, one of them is ours, but the other provider within the area is keen to move into the new building. And again, whilst we're not at this point predicting a merger of services, I think as they move into the building and both practices start to work together, then the building of a bigger, more sustainable GMS service will become more apparent to them and potentially is an option for the future. As with the development at Ringland, we are actively seeking to improve access to general dental services, and again there will be additional provision going into this site with a move of the current general dental provision onto the site, with an additional chairs being provided, an additional revenue cost to the health board in commissioning a much higher level of access for general dental services. We will be bringing together social care and third sector within the building itself, and are actively working with Blind and Gwent Council in terms of developing the model for the integrated sort of wellbeing service that will be provided out of the centre. So again, we covered this in quite some detail at the board meeting back in November of last year. I'm seeking approval today for the LPC so we can transfer that to Welsh Government with the hope that we can get construction started in April, May of 2021, which will be the first of our health and wellbeing centres on the primary care pipeline.
Thank you, Nick. Shelley?
Yeah, again, I do support this. Just a point of clarity, Nick, because one of the assumptions made in relation to the reduction of cost is that the managed practice will become not a managed practice, and I just wondered how realistic that was in terms of the overall cost of the project, because at the moment I'm not aware of any of the managed practices having been gone back to private ownership. So it's just a point of detail, because obviously that's one of the premises on which the financial case has been made.
Yeah, I think it's a very fair point, Shelley. I think at this point in time we haven't had success in re-tendering any of the managed practices back into contractor services. Interestingly, though, over the last, I suppose, 3 or 4 months, we've been much more successful at recruiting GPs into Tredegar. So we've managed to appoint a clinical lead and a further salaried GP onto the team, which obviously will drive down some of the cost of locums anyway. I think it may therefore afford a slightly different discussion with the other practice in Tredegar about their ability to therefore bring GPs on board as either contractors or salaried GPs, and therefore the opportunity might expand for us to move away from being a managed practice. But we haven't got a successful track record in that at present time, and I think it's a fair point. But I can see the costs associated with that starting to drift down now that recruitment has become slightly easier for salaried GPs and clinical leads.
Thank you. Tish, and then Paul.
Thank you, Chair. Thank you, Shelley, for asking that question, because I was going to ask that. Again, on the financial information, I think firstly, I absolutely support this. There's been an enormous amount of work carried out, which I have not been involved with, but have watched with interest. In terms of the financial case, I think it's really important to note that this option 3, is not the most cost effective, but there's a very good reason that has been that it is being recommended, and that is that there's been an enormous amount of consultation with the community partners and stakeholders, from what I've observed, and this option has been seen on balance as being the most appropriate. Now, clearly, when we look forward to our benefits realisation work, but want to endorse the case again, despite the most economic case based simply on financial information.
Yeah, I think it's a very fair point, but I think it's really important to recognise the cultural and heritage value to the local community of the existing site, and the work we've done locally with the local council, local assembly members, local MPs, community groups, etc., to support the redevelopment of this site is really important to them, and potentially, yeah, it's not a financial benefit, but culturally beneficial for the population of Tredegar. So absolutely recognise the points and the differential that this provides.
Did you want to add something? Sorry, Tish.
Sorry, could I just make one other comment? And that is a more general one in terms of these integrated systems that we're moving to. And that is that we have to be very, very mindful that we're not just creating a larger box for lots of organisations to occupy without an active integration. And I think from what I've seen, for example, health sector and talked to a number of providers there. And from what I've seen, I am assured that that is not the model that we're going down, that we're not pursuing a path where we're just creating large boxes, large buildings for everyone to sit in and not talk to each other and not provide an integrated service. So I do personally feel assured by that, and I just wanted to share that with colleagues. I'm hoping that way of working will be adopted in our other facilities.
Thank you, Tish. It's a very valid point. Sarah, did you want to add to that?
Yes, it's just building on that last point, really, in that we need to look at the benefit to Blaenau Gwent as a whole in the context of our legal duties under the Wellbeing of Future Generations Act as a core partner in the Blaenau Gwent Public Service Board. And it's picking up on Tish's point, which is by providing this building, we will enable integration of public service delivery in the Tredegar area as part of our contribution to realising the objectives of the Blaenau Gwent Public Service Board Wellbeing Plan, and in particular the economy of the local area. So it's the wider economy rather than the cost to the health board, which is the that integration collaboration part of the 5 ways of working under the Act. And by providing the foyer space and enabling a civic society to provide a cafe and potentially a heritage history facility there, it can actively be part of the heritage trail and support the tourism offer for the Tredegar area, which is part of the economic future for the area. So I think it's looking at the benefits beyond the benefits to healthcare as to the benefits of the economy of the local area.
Thank you, Sarah. Paul and then Emrys.
Yeah, I just wanted to sort of touch on what Sarah just said, and also Tish. I think the Tredegar scheme led to the NHS, and it has huge historical significance, that location. And I do endorse what Sarah's just saying about that becoming part of a trail as part of the history of it. So there's opportunities there as well. But equally, we don't just want boxes in a building. We want it to be fully integrated, and I think we've got reassurance on that, but I think that is a point that was very well made by Tish. The other thing is there is a sort of future the integration of services, and in particular the increase of dental services, because I think that's been an issue, and please see that being fully developed. And that finally I want to say is we also have a duty of care over our staff, and I think that these new models, new facilities, afford much better opportunities for recruitment as well. So I think all in all, it's got a real wraparound feel to these new provision, and I support it 100%.
Yeah, that latter point is well made and totally endorsed by Louise, who has pointed out the better working environment for our staff. Thank you. Emrys?
Yeah, sure. The service it's got my full support too. Multidisciplinary, multi-agency working is the way forward. I just think, just in response to some of the comments have been made, there are some great opportunities for us going forward from a multidisciplinary, multi-agency perspective, because now we will have the opportunity to assess the need that's coming into these health centres that will help to inform as to the types of responses that are required. So rather than becoming a single professional, as what that might have been influenced our thinking before, we'll now be looking at what are the agencies and skills that are required to respond to a person's needs within this new setting, and hopefully this new integrated method of working will help to inform on that.
Thank you. Thank you, Emrys. Any further comments? Are we then happy to endorse this FBC? Yeah, thank you. Before we move on to the Gwent Healthy Travel Charter, could I just apologise to our viewers that the live streaming is buffering. So we're going in and out of live streaming, and I'm really sorry for that. And the teams are working really hard to rectify the fault that has occurred. So I'm sorry if your viewing has been interrupted in any way. Could we go to the Healthy Travel Charter, please, Mez, briefly?
Okay, thank you, Chair. So this paper provides information to the board on the development of a Gwent Healthy Travel Charter, and today I'm sort of seeking the board's approval to participate in the charter. So in terms of context and background, the Health Board set up the Gwent Sustainable Travel Group, which comprised of representatives from the 5 public service boards in Gwent, with the aim of fostering a collaborative approach to sustainable travel across the region, to support and encourage staff and visitors to sort of organisational sites to use healthy and sustainable modes of transport. So its development is in line with the Health Board's Wellbeing for Future Generations Act's wellbeing objectives. So development of the Charter was informed by a staff survey that was undertaken across all organisations involved, and also benefited greatly from the learning from the work undertaken by Cardiff to develop its successful Cardiff Healthy Travel Charter. So the Gwent Healthy Travel Charter, working together with partners, commits the Health Board to working over the next 3 years towards a number of targets, and these being to reduce the proportion of journeys commuting to and from work made by car from 87% to 77%, to increasing the proportion of staff who use public transport to travel to and from work, to increase the proportion of staff who work from home 1 or more days per week where possible, and to increase the proportion of vehicles used during the day which are ultra low emission. There's a strong commitment from partner organisations to collaborating to increase the uptake of sustainable travel, and wider than the PSB partners, other partners as well as listed in the report are also committed to working in collaboration from elements of the Sustainable Travel Plan. The Charter will be considered by the G10 Group on the 28th of September, and in advance of this meeting, I'm seeking approval today from the Board to the Health Board's participation in the Gwent Healthy Travel Charter. Thank you.
Thank you, Mez. Are there any questions or comments, or are we all happy to endorse our participation and to accept Appendix 1? Thank you. I think that's really important. Thank you very much. The draft annual quality statement, please, Rhiannon.
Thank you, Chair. So all organisations across the NHS in Wales are required to produce the annual quality statement, the AQS. It's aligned to the health and care standards and the NHS outcomes and delivery framework, and is informed and directed by a Welsh Health Circular. I think more locally as well, it's aligned to building a healthier Gwent, which is really important. The AQS provides us with an opportunity to tell our story in terms of good practice and the initiatives that have taken place over the preceding year. It also outlines what's gone well, what hasn't gone so well, and the actions that we've been taking really to improve. We do this by our approach to what we said we were going to do and what we have actually done. So the document has to be public facing. So I know that the board members have had an opportunity to review it previously, but it also represents the financial year 2019 to 20. It's a requirement to have internal audit review the document. The internal audit have provided their clearance, having reviewed the content and the metrics contained within. This draft has had quite a bit of airing in the Health Board before presenting to board. It's been through executive team and also the Quality and Patient Safety Committee. At this point, I did just want to acknowledge a significant work that's been undertaken by Alex Scott, the Assistant Director for Quality and Safety, in coordinating its production, but also enabling us to be compliant with the revised timeline for production. We have had some comments through from independent members, which I've reviewed, and we can pick up. It doesn't fundamentally change the document, but a particular thanks to Shelley, not only for the typo that she picked up, but also her comments in relation to including the number of SIs that we had in that year. And additionally, and importantly, the IMs are included within the safety walk around, so we will include that in the document. Thanks, Shelley. So it's being presented today for approval by the board in order that we can proceed with publication. Thank you, Chair.
Thank you, Rhiannon. And thank you for picking up the points made by the IM Secretary. Are there any comments or questions, Emrys? Do you have anything to say as the Chair of Quality and Patient Safety?
Very happy and content with the work that Rhiannon and the team have been doing. It's a good piece of work, Chair.
Thank you. Are there any comments, or are we happy to endorse? I think it's a good tracker of improvements that we need to make, and where we need to concentrate more. Thank you, and thank you very much for all the team's hard work in producing it to date. Thank you.
Thank you.
The strategic risk report, Judith.
Yeah, thank you, Chair. Here for board members' comments, and I have had a couple of written comments in advance of the meeting, which I will come to shortly. But as per our usual arrangements, the entirety of the risk register has been reviewed and risk scores updated by risk score owners. Just to let the board know that we are planning to have a board briefing session, or more probably a development session, on the 14th of October to look at the board assurance framework and the risk appetite review. And of course, as we move to develop our Q3, Q4 plans, for which we have yet to have the guidance from Welsh Government, we probably will need to update our risk register to take account of any new or different risks that emerge from that. So risk report here for questions and observations. In terms of the issues that have been raised in advance, for which I thank independent members, I will draw in the individual risk owners if that's okay. So there was a question from one independent member about the risk rating of 20 on the healthcare infections risk, which sort of the comment was, well, we might have done very well, but the risk score is still very high. So Rhiannon, would you like to make a comment on that?
Yeah, thank you, Judith, and thank you for the comment. And I do understand the context within which it's been made. But in terms of the progress against that risk, there has been good progress. So the very fact that from the beginning of the COVID pandemic, we have seen limited nosocomial transmission within our hospital settings is as a direct result of the good work that's been undertaken to develop the pathways, ensure strong and robust infection prevention control procedures, the enhancing the infection prevention and control team, and us establishing a reducing nosocomial transmission group within the health board. So that the comments were in relation to the progress that's been made against the mitigating actions, whilst recognising we will remain a high score, we will continue to have a high score against that risk because we are and continue to operate in a pandemic with increasing numbers as we're well aware. Thank you.
Thank you, Ree. In relation to the flu vaccination uptake, comment received to positively support as learning lessons from last year, and just a general comment about the resurgence of the anti-vax narrative during the pandemic, and whether or not we need to do anything above and beyond just learning from last year in order to make sure that we have a strong uptake of the flu vaccine this year. So I don't know if Mez or Sarah wanted to comment, because I know we did cover this off at our last board meeting, as I recall. So yeah, so Mez is indicating she'd like to come in, so thank you. Thanks, Mez.
Yeah, thank you. Yes, just to add really that we are aware of the anti-vax sort of narrative, and as we go into autumn and the challenge of both COVID and flu, how important it is that we protect those vulnerable and to promote the uptake. So there's work going on in primary care to promote uptake of flu vaccine, and also through community networks, through the integrated wellbeing networks, and engaging with community groups to promote messaging and engaging with communities. And on a national level, Public Health Wales are sort of leading the comms campaign and messaging, and also will promote patient experience stories as well to promote the importance of flu vaccine, particularly in the season.
Thanks, Mez. I think both Sarah and Rhiannon might want to come in on this one as well, because I think it's a whole team effort on flu vaccines this year. Sarah, did you want to come in?
Thank you. I think there's certainly a lot of noise. I think what we don't know is what that's going to translate into in terms of percentage uptake by the population. And I think if you look at the response to the tightening of the measures to control spread of COVID, there's a lot of noise about freedom to act, but when you look at public support, it's actually quite high. So I think we have to look at, I think the answer is we need to look at the data, and we need to break that down in terms of the population groups we're trying to reach and what the uptake rate is by those population groups, and then do some targeted messaging in a way that we actually know will reach them. And so until we start, I don't think we really know whether that sentiment is going to translate into impact on uptake or not, because I think we are expecting the messaging around if you get flu, it will make you more vulnerable to being seriously unwell with COVID, will also be out there as well. So I think we'll just have to wait and see and deal with whatever is actually emerging in terms of our information about public opinion.
Thanks, Sarah. Ree, did you want to come in on this topic as well?
Yeah, I guess it was probably just to support what Mez and Sarah have said, but our campaign has started in earnest. We've had significant airing of this and our approach at the executive team to include our local agreement that we would increase the flu vaccination target in recognition of how important this is, particularly as we're operating in a COVID pandemic. There's also a clear plan in terms of engagement and communication, and we have also increased our vaccinator group, so we're really encouraging and supporting a larger number of clinicians and registrants to be involved in this process. So I think, as Sarah said, it's almost a not wait and see, but actively watch and act. But a really helpful report that we recently received from the Community Health Council in terms of their engagement with the public, mostly associated with COVID, but a number of the service user comments about flu vaccination through that report certainly indicates that people are actively waiting to get their flu vaccine. So I think it's watch and act. Thank you.
Thanks, Rhiannon. Chair, I don't know whether I'm chairing this bit now. Teacher's got her hand up. I've got a couple more comments I need to cover off. But Teacher, do you want to come back in on this?
Yes, thank you, Chair, whoever's chairing this bit. Can I just have some assurance that we are, in terms of engagement, that we are engaging with specific communities that we know are concerned about flu vaccines, because I am aware that there are particular communities where there is a lower uptake for various reasons and narrative within that community, and that it's not just a general pushing out of messages. I'm sure that's the case, but if someone could just cover that off for me, please.
Yeah, I'm sure Mez will be able to cover that off. Thanks, Mez.
Yes, thank you, Teach. Yeah, so the integrated wellbeing networks are working out in the community, and we have a lead for each local authority, and the work is around making sure we are engaging with particular groups and also wider sort of social vulnerable groups as well. So I'm happy to chat outside the meeting if that's helpful as well.
Okay, so Teacher's nodding, but you won't see her because you've got your back to her. We'll link you up outside the meeting. And then two other points. One was, should the failure to achieve financial balance, which is AMBER 16, be higher given the current financial forecast, which is in the finance paper later on the agenda. So, Glyn.
Yeah, thank you. So really, really good question, important question. And I think in a normal year, which we're not in, but in a normal year, if we were forecasting a deficit of almost 69 million pounds, I would absolutely agree, and I would certainly report the risk as much higher than an AMBER 16. My assessment of the financial risk as an AMBER 16, if you like, is based on a few things. So the first one really is we're not in a normal year. We know that we're delivering services through COVID pandemic. Welsh Government, we know, have secured an additional £800 million for what they call stabilisation of healthcare services. That funding is yet to be allocated, but we believe when the guidance is issued for the Q3, Q4 operational plans, that they will actually issue a funding allocation to go with that, which will be based on sort of health board population shares. So bearing in mind that will probably be a fairly large part of £800 million, I'm reasonably confident that would put us in a very different position in terms of our financial deficit that we're forecasting at the moment. I think added to that, the feedback that we've had from Welsh Government on our plans, including our financial plan, is they think they're very reasonable, and therefore I think if they had any significant financial concerns in the context of the money that they secured for COVID, I think we'd have a very different response and reaction from Welsh Government. I think they also recognise that, and some of this is in the mitigating actions, the way that we as a health board are ensuring that we're making informed financial decisions and managing costs around the COVID pandemic. They believe that we're taking a very reasonable approach. So in terms of managing public money, that we're doing it as well as we can in the circumstances. We've already had some early funding allocations on related to COVID spend. So we've had about £26 million of funding already. So I think the evidence is there that Welsh Government are systematically and incrementally providing funding to cover our COVID costs. And if you look at, so finally, if you look at our forecast deficit, it is made purely from COVID-related costs. So it's not as a result of anything else. It is the additional cost of dealing with the COVID pandemic. So I think based on all of those factors, my assessment is that it would be an amber risk of 16 rather than anything more severe. So I hope that sort of helps sort of explain my rationale and logic behind the risk scoring.
Thank you, and we'll be coming on to the finance report anyway as well. And then finally, a request for an update on WCCIS.
Yeah, thanks, thanks Judith. So I know we did a detailed session with the IMs a few months back, and there has been some progress, but nothing significant to update in terms of the board today, which is why the risk is maintained itself. Discussions have been continuing with the supplier, with a letter due to be sent next week, and also discussions with the national programme. The version 5.215 is currently being tested in line with the next step by the national programme, and there are still not final clarity on the position of the national programme around version 5 and version 6. My intention is to provide a more detailed briefing report for the Information Governance Committee on the 8th of October. I've had a useful pre-meet with David in terms of some of the clarity that we're seeking to get in time for our IGC meeting. So I'll provide a more detailed report at that point.
Thank you. And with that, Anne, I'm handing back to you.
Thank you. Thank you very much for that. Are there any further questions or comments? No? Okay, can we move then to the finance report, Glyn?
Okay, thanks, Chair. So you've got a finance report in the public board papers which relates to month 4 of the financial year. We've since reported month 5 of the financial year, so up to the end of August as well. So I'll update the board on the latest financial position. So at month 5, we were reporting a deficit of £11.1 million. Now, whilst this is quite significant, it wasn't as high as we were anticipating, and that was partly due to the fact that our recruitment around TTP, and in particular the contact tracing services, taken slightly longer than we originally expected when we were forecasting the financial position on a month-by-month basis. So that's the main reason for that. The forecast deficit after the end of August, so the deficit that we're forecasting for the financial year is £68.9 million. Again, clearly very significant, and particularly in the context of the sort of position that we're used to reporting as a health board. But as I mentioned before, that is entirely due to things that we've had to do as a result of the COVID pandemic. The forecast is very much based on our latest operational plans. So the plans that the board will have seen around Q1, our Q2 operational plan, and also around the opening of the Grange University Hospital from November. So that forecast deficit includes all the costs that we plan to incur in order to make those things happen. So that's quite important, particularly in terms of when we're reporting to Welsh Government and looking to hopefully secure additional funding around those plans. As I think has been mentioned previously, we will be producing a Q3/Q4 operational plan, so effectively a plan that takes us through the rest of this financial year. The guidance around that plan from Welsh Government is expected sometime this week, and along with the guidance, Welsh Government are planning to announced funding allocation. So slightly different approach to the one they've taken during the first half of the year, where in terms of COVID spend, they've incrementally looked at specific issues and then looked to secure funding for those. What we will now see is a funding allocation that will be based on our Health Board population share, that will go with the guidance on producing that Q3, Q4 operational plan. And I guess the important thing to note there is effectively it shifts the risk, financial risk, if you like, in that we will get a funding allocation, but we will be expected to deliver that operational plan within the money that they then allocate. So it is a slightly different approach, which I just wanted to draw attention to our board members. It's probably important to say that that funding that comes out is around stabilising NHS services during the remainder of the year. So there is potentially other funding available from Welsh Government if we're in a position where we can go further and look to actually recover waiting times in some of our services. And it's also likely that there will be one or two other areas where they will look to fund things separately. So, for instance, we're developing a plan and implementing around mass vaccination for a potential COVID vaccine. We would expect to get separate funding for delivering that programme. There's a level of detail that I haven't seen yet, but we will need to work through probably in the next few days and weeks as we finalise our operational plan, and then I can come back to the board to give you a bit of a clearer picture. But hopefully that gives the board a bit more assurance around us securing extra funding to deliver our plans as we go through the rest of the year. I just want to quickly highlight on savings delivery, which has increased slightly. You'll see it's still not to the level that we'd originally planned in our IMTP, but I think given some of the circumstances around COVID, it's understandable why the organisation has had to shift its focus. But those savings plans will be really important when we start to look at our recurrent financial position. And in the context of opening the Grange Hospital and the paper that you received earlier, that identifies an increased cost and recurrent financial deficit as a result of opening the Grange Hospital and delivering those wider services. So it will be really important that we push on some of the savings. And in the report that you've got in the board papers, I identified some of the key areas that we need to look at and take forward. So we've already got some programs in place around musculoskeletal services and eye care services, and also some of our outpatient services. But we will need to push forward in areas like rationalisation of our estates, how we're doing in terms of agile working and how we sustain some of that, and a number of other areas which will contribute potentially to us delivering better care for patients, but could enable us to reduce things like the number of beds that we require across the system. And again, I think that was one of the questions that was raised around one of the earlier papers. There is an opportunity to run the system effectively with a new hospital that would enable us to run with fewer beds. That would also probably help in terms of workforce. So these are a number of areas that we will explore further, and the plan is to have a board briefing session on the 28th of October, by which time I hope to be in a position to present the financial plan for this year with some certainty around Welsh Government funding, but also look at the recurrent financial position, the savings and efficiency opportunities that we've got as a health board, and some of the plans that we need to push forward to actually deliver that, so that we've got a stronger financial position. The final point that I just wanted to raise is just to make the board aware that In terms of contracts that we have with other health boards, during Q1 and Q2, we've effectively agreed a block financial arrangement with them, irrespective of what services they deliver. This is a sort of an All Wales arrangement that was designed to provide financial stability across NHS Wales during the first half of the year. Just to make board members aware that in terms of Q3, we're currently having discussions about whether we continue that block arrangement or whether we should expect some organisations to be restarting some of their elective services, and therefore we would look at actually measuring performance against parts of those contracts. So as you can imagine, there will be some health boards that will be adversely affected by this and some that will potentially benefit. So it's quite a complex discussion, but I just wanted to make the board aware because it does have a financial impact for us. I'll pause there, happy to take any questions.
Thank you, Glyn. And I think the session on the 28th of October will be really important to allow us to have assurance that we are making the best use of the resources that we have available to us and producing high quality, cost effective services and to try and adopt a slightly different approach to this for the future. I have David and Shelley.
Thank you, Anne. Thanks so much, Glyn. Could I just ask a little bit more about the savings? You gave a good update on where we are. In terms of accelerating it, is your view that it's going to be difficult now with about 7 months of the year left to be able to get close to the target that we put in place? Whereas what we may be able to do is to build up capacity and capability so we can really hit the ground running for next year. Is that a reasonable strategy? I mean, obviously, I accept that every single pound we can save, we absolutely should do. But I'm just conscious that to get this stuff done, it really is it's a people thing, isn't it? You know, there's stuff on procurement that we can do, but there's the deep-seated culture that maybe we need to move the dial on just a little bit, and perhaps that is inevitably going to take some time. Probably something that Geraint might want to chip in on as well, to be fair.
Yeah, no, I mean, it's a really good question, David, and I think there's a number of elements to it for me. I think there are some things that we can continue to try and deliver savings on, and to a certain extent, I think the organisation has done well in achieving the level of savings that it has done. I think there probably are one or two areas where we would say, because of the circumstances that we're in, we're probably unlikely to deliver savings this year. So if you look at things like theatre productivity, for instance, it would be very difficult, I think, to really push on that during a time when we know that actually if our theatres are available to treat patients, we have to do that in a very safe environment, making sure that there's use of PPE, social distancing, hygiene and infection control, which will naturally reduce productivity and the number of patients that can be treated. So I think there are things like that that would take a lot longer to deliver. I think there's something about using this year to build up some of the strategic change that we can make, and I think some of the programs that we've already started to implement around musculoskeletal and eye care services, where we're looking at delivering a more integrated approach to how we provide care for patients, now is a great opportunity to do that, because we find ourselves in a place where actually because of the pandemic, I think a lot of people are up for making those service changes. And I think we can do it in a way that will ultimately improve outcomes for patients, but allow us to actually redistribute the way we use some of our funding and resources. And I think also the pandemic has forced us to accelerate other areas. So our use of technology, using Microsoft Teams today, the extent to which people are working from home and doing a lot less travelling means we have actually changed the way that we work quite considerably this year. And I think now is an opportunity for us to look at how we sustain some of the good things around that. So I think there's a mixture really in terms of trying to answer your question, David. Some things we've accelerated, some things will be delayed, but actually this year is a good opportunity to do some of the strategic changes that we can make, which will improve care for patients and make better use of resources.
Thanks, Gwen.
Shelley?
I just wanted to pick up with Glyn what you said about one of the savings areas is in relation to rationalisation of estates. And as you know, the estate strategy is quite close to my heart because I've been quite involved in it. And whilst I think there are opportunities there, I think it's really, I suppose I'm reflecting what David was saying, some of those are going to be on a longer term basis. So I know we're implementing and taking forward the agile working, but unless, for example, everybody in a particular building stops being in that building, then I know you'll make some savings around energy and what have you, but it is going to be a sort of a slow burn on some of that stuff. So I think we need to be realistic about, as you said, Glyn, in terms of what we can achieve and what our long-term programme is. And I think we are looking, Nicola, if I'm right, at the estate strategy, and actually do we need to re-look at some of the priority areas and some of those savings that, you know, we can make, bearing in mind where we currently are and also where we might be going with services in the future. So it's just an observation more than anything. Thank you.
Thank you, Shelley. Sarah?
Thank you. Thank you. I was just an example where we have rapidly accelerated change in the strategic direction we wanted to go in was in outpatient redesign in response to maintain services in response to the pandemic. So it was just a detail, and what Glyn said about some things have been accelerated and other things perhaps have been held back.
Thank you, Sarah. That was helpful. Glyn? Geraint?
Thank you, Chair. Just picking up David's point about cultural change, you know, necessary to try and help us deliver these the savings. I think just my comment on that would be, I think it would help, you know, it will help if we identify and encourage the behaviours that you know, that we'd expect in terms of trying to deliver savings, and that's difficult in the current environment. But I think it is about behaviour, and therefore perhaps, you know, focusing on that will help. The second point I was going to make was in relation to Shelley's point about estates and what we're doing in relation to that. One of the short-term priorities for the Agile Working Delivery Group is to provide, by the end of this month, a map of all the health board's estate, identifying the space that's available, the staff who are occupying that space currently, and the IT capability of each site. So we're trying to bring that together into one place so that will help us inform decisions around estate utilisation going forward. Thank you.
Thank you. Paul?
Could I ask about, is any confirmation of any additional funding from the Welsh Government? And if so, what is it? Not when are we going to get the information? Because that's going to be quite crucial to our overall budget, I would have thought.
Yes, so we're expecting to hear what the funding allocation will be probably this week sometime. So I don't know exactly how much it is at the moment, but all I'm aware of is that along with the guidance for the operational planning that will come out this week, Welsh Government intend to notify every health board of a funding allocation that will go with it. Now, importantly, it will be based on the funding formula that's used, which is a population-based formula. So of the funding that Welsh Government make available to effectively stabilise services over the second half of the year, we know that we will get our sort of population share. So I'm expecting that in the next few days, really. So that will be formal notification from Welsh Government of the funding that we will receive.
Yeah,
so
well,
I'm happy to share it with the board.
No, that's helpful. I just wanted to understand the criteria and rationale for the decision on the allocation of funding, because I am aware that population is one criteria, but of course the Welsh Government could decide another criteria. So are we reassured that the basis of the funding for our health board will be based on population?
For this particular funding, for the plan that takes us through the next 6 months, yes, it will be based on the funding formula, which takes account of our population, both in terms of size, but demography as well.
Well, that's encouraging and that's really helpful. Thank you.
Thank you. I think we need to note, however, that Welsh Government is working currently on a revised resource allocation formula, which we'll receive details of at a later date. Okay.
Yes, I mean, for the purposes of this, our population share will be about 19%, so it won't change much in terms of any changes in funding formula.
Thank you, Glenn. Any further questions or comments? Okay, performance report.
Okay, thanks very much. I was just going to sort of cover off a couple of things and then really open this one up for questions and comments. I know board members will be aware that I think it was back in March, Welsh Government effectively suspended the reporting of performance targets, and that was originally at the time that was suspended until September. We are now in September. We've not heard anything formally from Welsh Government about whether those targets will be reintroduced in terms of reporting, but we do know that there are various discussions going on with Welsh Government about how we might measure performance going forward. So at this stage, we'll continue to report and measure the existing performance targets. And obviously what you've got in front of you in the board papers is the latest update in terms of how we're performing against the pre-existing targets that we were being measured against. You'll see that obviously there's been an increase in waiting times for elective treatments and diagnostic interventions. Where we've seen some improvements, I suppose, during the last few months is around access to emergency care, although as we see a rising demand in attendances to EDs, we're seeing that performance tail back slightly as a result of those increased pressures. Again, I just wanted to draw attention to board members in terms of cancer performance. And if you look at the single cancer pathway target, that improves slightly to 73%. And I guess what's encouraging is as we've gone through the pandemic and we're beginning to recover and restart some of these services, we are seeing some of that performance get back to a sort of a better level. Similarly, I think probably worth pointing out in terms of some of the mental health performance targets, again, access to assessment and interventions is still reasonably good, and I think in circumstances, again, is encouraging, and similarly with access to CAMHS services. So as our plans to sort of implement sort of recommencing services moves forward, we would hope to see some of those performance targets improve. Obviously, that's in the context and backdrop of what we're seeing over the last few weeks, really, which is a rise in transmission rates, which could then potentially impact on the level of hospital demand. And then consequently, we would probably then need to review our ability to still deliver elective services if there is a significant increase in COVID demand in hospital care. So that's all I really wanted to sort of cover in terms of the performance report. I'm conscious there's quite a lot of different targets on there, so happy happy to take any questions.
Thank you, Glenn. Are there any questions? I think it's good that we have continued to report our performance, and I think to enhance this for our next meeting, obviously we will have the performance we have achieved against the Q1 and Q2 plans, and I think it is also important to have a note of the urgent services that we have maintained throughout, to give assurance again to the population that these have not been abandoned or stepped down as a result of COVID. So I think that would be helpful, and that it looks from the report as if the performance in non-planned care areas has been good, given the circumstances and the difficulties in delivering such care. So thank you very much for that. Okay, the matters. Key matters from committees. To start with, planning. I have nothing further to report. The issues that were discussed at the planning meeting have largely been discussed here today, so they've been provided to the board. Yep. Audit, Shelley?
I've got nothing else to raise than what's on the report.
Okay. Any questions to Shelley? No. Charitable funds, Tiege?
Just very briefly, thank you, Chair, just to recognise the enormous generosity of the public in this last period, which has boosted charitable funds, and reassurance that every single application to those funds is scrutinised before being issued.
Thank you, Tiege. Any questions to Tiege? No. Quality and patient safety, Emrys?
The only thing I just want to echo again on the report is around the new reporting format that's been developed around the health and care standards, and that will continue to develop how we whilst we're deciding how we measure our outputs going forward.
Thank you. Any questions to Emrys? Whisk, Judith?
No, just ask board members to note that Whisk and EASC have continued to meet with adjusted governance in arrangements in place, and I think you've already drawn attention to the successful launch of the trauma network, but nothing else to bring to board members' attention. Thank you.
Thank you. Any questions to Judith on Whisk or EASC? Okay. Is there any further business? Well, could I just say that this is David's last formal meeting with this board, although he's not leaving us yet. And I'm very sorry that we're not all meeting in person so that we can thank him really more effectively. But I should, on behalf of the board, like to thank David for his massive enthusiasm and his attention to detail in an area which eludes an awful lot of people, and for the support and the work that he has provided to the teams and to ourselves in this very important area. So thank you very much indeed, David, for your contribution, and I wish you all the best for the future in whatever you decide to do.
Thank you. Thank you, Anne, very much. As you rightly said, I've got one IGC still to navigate through in a couple of weeks' time, but yeah. Thanks to you, thanks to the independent members, thanks obviously to the executive and all the staff. I've had a great time. I've really enjoyed it. Thank you very much.
Good.
And it's Judith here. Could I also say that I believe it's Richard Bevan's last board meeting as well?
Oh, right, I thought he was here in November.
He will be retiring from the NHS in November after many years of service. So many years I can't remember, but clearly he's been the board secretary at Ira Bevan University Health Board since the board was established in 2009. He's done a sterling job steering us through quite a lot of changes. And again, just to put on record, the executive team, and I'm sure the board members, thanks for all that he's done to support the effective governance and organisation of the health board.
Thank you, Judith. And can I reiterate the support, the gratitude of the board and the independent members for the support that has been given to us by Richard, and for him putting up with my ranting about things from time to time. And we wish him every success in his retirement. And thank you all for the huge amount of work that has gone on. Thank you.
Thank you, Anne. Thank you, Judith. Thanks, everyone. Thank you.
Thank you. Just to remind ourselves that the next meeting will be on the 25th of November at 9:30, and that our AGM will take place on Wednesday. This will be a Facebook Live session and will be advertised properly and effectively. But we would like as many people as possible to attend virtually. And before I close this meeting and move into in committee, I'd like to thank all our viewers this morning. We hope that that we have been clear in what we've tried to say. We hope that you found it interesting, and we look forward for you being with us again soon. Thank you. I think
colleagues, if you could stay on, we'll suspend the live streaming. So if you could just